That's what I thought. Okay. Hey, everybody. I am really grateful that you are with us tonight with our stories, our health, and we're going to talk some about the pandemic, our shared experiences around that. And we're going to hear from some healthcare providers and leaders in healthcare here. And then we're going to talk a little bit about what we need to do to build a better system. And I was really delighted at how many people decided to join us tonight. We know that we've been talking about COVID, which feels like for a year, because it's been almost a year, and we're not through it yet. And it has really tested so much of who we are and what we believe in terms of science and solidarity and empathy and the mettle of our healthcare marketplace, which in many ways has not really met the test of a global pandemic, and in America, what feels like a real humanitarian crisis with so many people sick, so many people who have died. And so while we have many months to go, I think before we are in a way able to return to life together, it is important for us to start thinking about the ways in which we need to act together to build a system that actually serves people, a public system, publicly financed, that is responsible for our care and accountable to the people. That's missing right now in American healthcare. And we believe at our Stories, Our Health, that it is time to build it. Somebody asked me the other day, do you think you need to tear the house down or add another room? And I said, I think we need a new foundation and we need a new commitment to the people. So it's not about tearing down the house or adding another room, but creating a brand new foundation so that people in Minnesota and in America can get the healthcare they need when they need it. I am really, really delighted that we have such an expert panel with us tonight. And I am going to wait just a minute or so before we get started to make sure that our participants are here. And so thank you very, very much. You know, grab a glass of water or a glass of wine if that's your preference. And we're going to have a discussion, you know, among us first for the first hour. And then afterwards, we're going to do a little after party, as we call it, where we can take your questions. And Haley, if you want to wave, Haley, our associate director, she is gonna, you know, not only collect your questions in the chat, and I bet most of us by now have worked in Zoom. So add your question in the chat, but she's gonna call on you for you to ask your question to the panel. And so, you know, we're gonna put you on the screen, and if you're in your PJs, you know, put on your robe. That's what I have to say about that. Okay. Thank you very, very much for joining us. I think it's time for us to get started. As I mentioned, we are really honored tonight to have so many of you joining us and to listen to a panel of healthcare providers and healthcare leaders talking about our shared experiences in this pandemic with COVID. And we're going to talk a little bit about what we need to do to build a better system. And then if you hang out afterwards with us, we'll have time for Q&A. So let us get started. I'm going to be your moderator tonight, and I'm going to be introducing our panelists to you, and they're going to take it away. So without further ado, as they say, I'd like to introduce the board chair for Our Stories, Our Health, Dr. Hannah Lixon. Hannah, would you like to introduce yourself, and then I'll share a question with you and we can get started.
That sounds great. So hi, everyone. Thank you again for taking some time of your evening to be with us, you know, together apart, as I say. So I am a primary care doctor. I work at Hennepin Health in Minneapolis. I take care of kids and I take care of adults because I just like taking care of everybody. And for the past, well, since it began, have been the co-chair of Our Stories, Our Health. So it's nice. It's nice to be here with all of you.
Thanks a lot, Hannah. I'd love it if you could start by sharing a little bit about your experiences, you know, as a provider, but also as a parent, And as a Minnesotan, as we have made our way through now these, I guess, almost 9 months of COVID, I will say that I sit in the intersection of healthcare and politics and policy and have for much of my career, and have been blown away really at how political a pandemic has become and what that has meant for people's health and well-being. And over again have found we make progress when we are able to hear from people with real experience in the system, caring for people. So one of the reasons why I thought it was important that we do this tonight is to bring a little bit more enlightenment to people about why we need to do the things that we need to do to keep each other and ourselves safe. So if you could share a little bit about your experience, I'd love it.
Yeah, so yeah, I don't want to make any assumptions about our audience members, but if you didn't go to medical school or nursing school, they don't teach us politics. They don't teach us policy. They don't teach us how to get a governor to enact an executive order or change one. They teach us how to diagnose a specific illness, how to care for a patient who has that illness, some basic things about how to stay healthy. They don't give us tools to get people food or a stable place to live. But those tools that they didn't give us are foundational to health, especially during a pandemic. And so as much as what we call those social determinants to health were important before, they are more so now. Because what I've learned and come to just know deep in my bones during this pandemic is what I think probably some of you have heard many healthcare providers say, that we are not, your front line, we're your last line of defense in this pandemic. The front line is meeting all of those other basic needs. And with regard to COVID, it's staying home and staying safe and having the ability to protect yourself and have some distance. So my job during this pandemic has changed dramatically, in as much as what I do in my clinic, I find matters less and less. And what we're able to do in the community or statewide matters more. Because once I'm treating an illness, once I'm treating your pneumonia or your COVID, or I've made that diagnosis, I have very limited tools, because I don't have the tools to give you a safe place to spend the night. I don't have the tools in my clinic to make sure you have access to healthy food every day, or childcare for your kids while you're in the hospital. I don't have those tools once you're in the clinic. We need to build those tools up front. And so what I've learned and come just to really feel passionately about during this pandemic is that my best way, one of my greatest abilities to care for my patients, lies outside of the clinic. And so I have spent a great deal of time organizing and advocating, both with our stories and with other just groups of physicians and other healthcare workers, to say, no, look, this is what we need. This is what Minnesotans need to stay healthy, and focusing only on the details of the medicine and the healthcare is missing where we can actually make the biggest difference. So that for me has been just a huge experience and a huge change from how I saw my role as a physician before this started.
Thanks, Hannah. Next, I would love to hear from the president of the Minnesota Nurses Association, Mary Turner. Mary is an ICU nurse and has been for now the entire time of this, caring for COVID ill patients. And she's also been a real advocate on the front lines, the media, talking with elected officials about what nurses need. So Mary, thank you for joining us. And I'd love to hear a little bit about you and about your experiences.
Mm-hmm. Okay, as Erin said, I'm president of Minnesota Nurses Association, more importantly, a COVID ICU nurse on the night shift at North Memorial in Robbinsdale. And I've been on the front lines since end of February. We saw, I have lived through the actual learning about COVID. I mean, Hannah would appreciate that. That was, it seemed like every other week it was hitting a new body system that we had to figure out what to do and how to treat it. And went through trying we even tried the name of I never get this right, chloroquine, that one. We even tried that for a week. So we had all of that experimentation that had to go on at the beginning. And I would have to say that for the nurses that I worked with, that was probably the most high stress time, because at that time, if you guys remember, everyone was so afraid. Our floor was literally to kind of go quarantine from the rest of the hospital. It almost felt like they'd open the elevator doors, throw our supplies out into the hallway, and then quickly close the elevator doors. And we felt very isolated and very alone because everyone was so afraid. And so, and then to be having to go through learning. And then on top of that, the PPE shortage, the personal protective equipment shortage, and all the battles that have gone on between the states and the governor's office saying, well, we thought we have 1 million masks coming, and then all of a sudden they weren't there. They were confiscated and sent somewhere else. It was a horrible time. And I am not by any means saying that we are back to what we're supposed to be. Optimal PPE is one-time use for our N95s. We are not at that at all. And my fear is that it's going to become the norm to never get back to that. And I remember a time when we were short on isolation gowns, and any medical person on here will be totally disgusted by the fact that we were reusing that same filthy COVID gown our whole shift. We had some healthcare companies where they were using it for a whole week. So we had to go through all of these hardships while being under the stress of taking care of very, very sick people. Because even if you came into the hospital and had COVID and you were on a medical floor, at the drop of the hat, you were being shipped off to the ICU and laid on your stomach. You hear about being prone, and now the hospitals, thank God, have now finally started to illustrate exactly what this means, because I have been on the media since the beginning trying to explain to people what this is all about. And I just have to use this venue to say how frustrating it has been for me to feel like sometimes I was the only one speaking out. And so I'm so glad that now the hospitals are starting to get in on the act and showing the public what it's all about, because they need to know. And they should have known months ago, but that wasn't the case. I could go on and on. A lot of frustration. I will say, just for the viewers, that to talk to President-elect Biden was so far the highlight of my career, because you know why? Because I finally felt like I was speaking to someone who was listening to me, and it was somebody that could potentially do something about it.
Thanks, Mary. Thanks a lot. And how are you keeping yourself moving? How are you keeping on, and with the nurses that you're working with, keeping people in that space of, caregiving, because that is the work of the profession.
Well, when I'm not at work at my job, or I'm not quarantining myself here, I am still all over the state wherever the nurses need me to be. I've been at more picket lines for not only nurses, but frontline workers, begging and pleading for protection. And I've been on those lines, all social distancing, all wearing masks, etc. I've been all over northern Minnesota, various hospitals, fighting for the rights of our healthcare workers to just be safe during this pandemic, which is a sad state of affairs to begin with, that we should even have to be out on the sidewalks begging for protection during a pandemic.
That's right. That's right. But thank you for your fight.
Thank you.
for fighting for all of us. I am so happy to know that Alita Borwood has joined us tonight from Rochester. Alita is a physician and my friend. Alita, I would love it if you'd introduce yourself and share a little bit about your experience over the last 9 months and beyond, right?
Thanks so much. And Mary, I just have to say thank you for your advocacy, as I have a sister who is an emergency room nurse in Minneapolis, also on the front line. So, you know, I am a physician. I spent 20 years at the Mayo Clinic as a hospitalist and geriatrician. I actually left 5 years ago my practice, and I've been very deeply involved in fighting for high healthcare access for our rural communities and farmers with the Land Stewardship Project, because in a lot of ways, it's our rural population that has the worst access to healthcare. And this pandemic is really hitting our rural communities extremely hard, and it comes on the back of years of farm crisis and farm foreclosures. You know, there's really deep poverty in rural Minnesota. More people are on our food stamp SNAP. People are older, they have more chronic disease, more disability, and that means that there are more people in rural Minnesota who are on our public insurance programs, so, you know, Medicare, Medicaid, which is medical assistance, and Minnesota Care. Very few people in the rural areas have employer-based insurance. You know, there's not a lot of large employers, and what it means then, if you're a small business owner or a farmer, you're buying insurance on the individual market, and those policies, as many of you know, are extremely expensive. You know, it's not uncommon to have a farm couple, an older farm couple, paying about $40,000 a year between their premiums and their out-of-pockets. And then what's also difficult is that there's so few insurance companies will actually offer policies in many of our rural areas. And so the clinic that's down the street and the hospital that's down the street might be out of network for you. And so you can't access it, you know. So what does this all mean for rural people? You know, people delay seeking care because of the expense and the distance to actually reach a provider. And even before this pandemic, people were dying of preventable diseases just because they never got preventive care or regular care. People in rural areas have, on average, 3 years shorter lifespan. Okay, so they have these chronic diseases, and now they're facing COVID. And so people are really at higher risk of dying from COVID because of their age and chronic disease. And if they seek care, it's at a crisis acute stage, and they may not get to a hospital in time because of the distance, because of the closures of clinics and hospitals in rural America, and also in my area in CD1 in southeastern Minnesota. You know, and we have to acknowledge that among the hardest, one of the hardest places, some of the hardest places that have been hit by COVID in our state have been those places where we have meat processing plants. You know, Wilmington, Wilmer, Cold Springs, you know, and many of the people who work in those plants are immigrants. Some of them are undocumented. Some of them have family members who are undocumented. And so thus many of them are uninsured. So this is something, as we know, if you have people who are uninsured in your community, no one is safe. And also, so, you know, we think about who has been affected most by COVID, you know, the indigenous people, Black people, Latinx people, and now you add the intersection of rural onto that. So you have really extreme challenge accessing and getting the care that you need. Finally, I just want to say that one of the crises in rural Minnesota before the pandemic was severe mental illness. You know, is affecting our farmers, but you know, all of rural areas. And now we're facing increasing shortages of mental health care providers in rural areas with increasing level of stress. You know, farm crisis plus this pandemic. So.
Thanks a lot, Alita. You're bringing a very important perspective to us as you talk about this. And we're going to go down in our next section talking a little bit about the gaps in the current system, and you just drew our attention right to them. I really appreciate that. Next, Bryce Maples. Student at George Washington University and serves on our board. And I'm really grateful that you're here tonight, Bryce.
Thanks, Erin. Hi, I'm Bryce. Thank you, everyone, for joining us. As Erin said, right now I'm a college student. I'm a junior at George Washington University studying history. Right now, due to the pandemic, I am living back here in Minnesota, and I'm happy to be here. Not so much under the circumstances, but in the place. I am a person with a disability. I have used mobility aids since around the age of 5 and have used a power wheelchair since about freshman year of high school. And I've had multiple reconstructive surgeries, so I'm very familiar with the healthcare system, and I am very familiar with its failings. And you know, if I've really, I mean, I already knew this before the pandemic, but if the pandemic hasn't reinforced one thing, it is what my other panelists have already touched on, in that healthcare is so much broader than just going to the hospital or you know, just one part. It is where it is your housing, it is your food, it is your education, it's everything. And I think if we see what countries have really succeeded in quashing this pandemic, it's been countries who have viewed this pandemic as a whole societal problem, not just as a health problem. In countries like Cuba, for example, before they even had a singular case, they were having doctors and nurses knock on people's doors and collect health information, figure out who was at risk before there was even a single case on the island. And you know, it's they have a higher percentage of doctors to people than anywhere else in the world, and they're paying people to stay home. We're encouraging people to go out, and that's the last thing we should be doing.
That's right. And you know, it is amazing to me, and I mentioned this before, how politicized the pandemic has become in the United States. I will also say, from my perspective, the federal response, the national response, the response from the current president, from my perspective as a registered nurse and as a human, is criminal. And the lack of response, the lack of a coordinated response, has contributed significantly to the number of people who are sick and dying in this country. And as I listened to the news over the last couple of days, the projected numbers of people who will lose their lives between now and next spring is enormous. And it is hard to imagine that we are experiencing that. And at the same time, people are unwilling to put on a mask because of the way this has been politicized. But also looking across the globe and seeing how other countries have successfully managed this. And instead we are, you know, heading into a deepening surge. Is just not anything I would have ever imagined experiencing in this country, but here we are. And it is like cold water in your face, one, that we are experiencing this, but two, like, wake up, America, and let's look at what we have made in terms of choices, in terms of a healthcare marketplace, not even a system that is really built to make money and not provide care. I'll step off my soapbox now as your moderator, and I want to introduce our last panelist, Abir Saida, who is serving on our board as well, and has already taught me so many things about what I was missing in terms of the ways in which we've got to think about the system and how we have to build it into the future. So Abir, thank you for joining us tonight.
Well, thanks, Erin, and I will just take that soapbox and step on it myself. Hi, everyone. I'm Abir Saida. I use she, her pronouns. My day job is that I am the Director of Equity and Inclusion at Students United. And Students United is an organization that serves as an advocacy organization for the students at the 7 Minnesota State universities. So that's 50,000 students all across Minnesota, both the metro area and greater Minnesota. I live in St. Paul, but I was born in Canada, and I think that that is a really important part of my experience with COVID and this pandemic, because my beliefs about this healthcare system are not fantasy and delusion and like my youthful naivete. I'm not just a child who dreams big, but I have seen a different healthcare system, and by no means is it perfect. But I know in my gut that human beings deserve better than what we receive here. And I've seen human beings receive much better than we have here. And so I wanted to start with that, because I'm going to talk more about this later as well. But I don't work in the healthcare system, but I work with all these determinants of health that we've talked about thus far. And one of the hardest things for me, and I'm so glad folks have brought some of these perspectives in already, is to watch people feel like they're not owed more, that these are the crumbs that we deserve, that this is the bloodshed that is acceptable. I don't believe that to be true. Everything I've seen with COVID personally in my life and professionally has been about watching these existing inequities of our system be exacerbated to the unprecedented deadly level that it is. But it was always there. It was always in the foundation of the system that we live in. And they always said, I remember hearing, COVID doesn't discriminate. And that's a myth, because COVID, like every single other experience of health in our society, is received and experienced through fundamentally discriminatory systems. Working with upcoming leaders, students in higher education, most of whom are young, it means a lot of times I'm watching young people who are saying, my healthcare outcomes are not as beautiful as everyone makes them out to be. I am homeless. I have children. I don't know where my next meal is coming from. I'm Black, I'm brown. I am an immigrant. I am glassy-eyed and emotionally overwhelmed and anxious, and 5 people are using my internet, and I don't know how I'm going to get through to my next meal, and I don't know if I'm going to be in this house next month. I am watching all of them feel very personally as though every single decision is their responsibility and every single harm is their responsibility, while the folks in power and folks in positions of authority simply have not made the right decisions themselves. So they feel over and over like blood is on their hands. And do not get me wrong, individual choices are incredibly important in this moment, but individual choices can only go so far when our leaders don't make the decisions we need them to make. I really believe all of our decision making, our politics, our policies, our movements need to be centered in the lives of real people and in with care for our most harmed. I think that in a community, every child is your child, every neighbor is your family. And when we see things that way, the decisions get a little bit more clearer. And so far, I'm a little disheartened because I have seen policies that don't see every child in Minnesota as our own children. I see us hesitating to mandate masks when we know we needed to. I see us putting people who were not sent out to die. This was not a war. We did not need soldiers being treated as though we're ready to sacrifice them. I'm seeing people authorize the use of chemical irritants that make people cough while they're protesting in the middle of a pandemic that is received through airborne particles. I'm seeing an executive order that is allowing for law enforcement to receive people's personal health care data. And I'm thinking about the eviction crisis that is going to be upcoming and the mental health crisis that is incoming and the crisis for our workers in the medical system and around the medical system. And I just wonder if all of us are finally ready to believe in politics and believe in movements that center everything in the voices of real people, real human beings, and real stories. So that's been my experience.
Thank you very, very much. Yeah, that's right. I want to turn a little bit to the what are we going to do? Because I do think we, knowing what we have experienced and what we've seen, each from our own vantage point, I think demands then the next, what do we do? Especially in a country where, and I still believe that we have the ability to change, to make the necessary change. It's not easy, we know that. I've been working in health policy for a long time. and that intersection between healthcare and nursing and politics and health policy. And we have been in Minnesota, often prideful about our leadership. And there are things in our past that we have reason to be proud of. But we do spend a lot of time nibbling around the edges, thinking about how to extend coverage a little bit more to a group of people who are not fully covered, how to, make sure that, things aren't too expensive. And as we have come into the depth of this pandemic, it's required a lot of law change, executive order, demands on the current marketplace to make sure that people were getting the care that they needed. And we continue to hear stories about people who, when testing was more scarce, they were getting a requirement that they needed an order from a primary care provider to get a test when the law said everybody should get a test and treatment without charge. We know that there are barriers put in place in the current system to delay and deny care. And it is crazy to me when we are dealing with an infectious virus that those policies would persist, and yet they do. And so at our stories, we've been spending a lot of time thinking about what do we mean when we say we want to transform, we want wholesale change in our healthcare system. And for us, it came down to, a pretty simple set of principles. We believe in a publicly financed system that is accountable to the people, separated from employment, accountable to the people, and responsible for the care of all of us. That's what we believe. When somebody says healthcare is a right, when I hear healthcare is a right, that's what I think about. And we're nowhere near that right now. We're nowhere near that. And it will take, all of us together to make the kind of change we need to make. But here we are in the middle of a healthcare crisis, and we're fighting like hell to make sure people get care. And the care providers are fighting like hell to make sure that they're safe. And all of that is proof that we need to make significant change. So what do we do? And we're going to go in reverse order. I'm going to come back to each of you and hear a little bit from you about where you think we need to pay attention based on your experiences, based on your story, based on your knowledge, and based on what you hope for. So, Kabir.
Back at it. This is an important question, and I think I've put on all these little hats, and I think like all of you and everyone that's listening right now, you interact with the healthcare system in so many bizarre ways beyond just the experience of being a patient or a receiver of care, or vice versa, being a provider. My first time purchasing insurance was at 22. I had to get my own insurance. I was on my university's plan because universities have to provide insurance as well, not just for folks who are underinsured, but because if you receive international students, it is a federal mandate that they have institution provided health insurance. So like employers, higher education institutions are also in the business of working with insurance providers. And I remember we were picking a fight about our plans because for some of our University of Minnesota's rural campuses, and actually the same extends to Minnesota State's rural campuses, the insurance provider was not the medical system in the community was not in network via the insurance provider of the system. So, we were alluding to this earlier, the Winona State campus, international students who are using the plan sponsored by Minnesota State cannot call an in-network ambulance and be taken to an in-network hospital in case of an emergency. And so they're paying $500 to $1,000 for an ambulance. And it's devastating to watch. I work with students. Some of these international students are from Nepal and India and Nigeria and Congo and Germany. And they're like, what are you talking about? And I'm like, honestly, I don't even know. I have to Google words to this day: premium, copay, coinsurance, deductible. I mean, it's endless. And it's not literacy that you're taught in this system either. It requires so much awareness of a system, and it forces you to advocate so much for yourself. And that requires so many degrees of power and privilege that every time I interact with the healthcare system myself, I wonder about everyone who isn't like me, that doesn't have the college degree, that isn't fluent in English, that doesn't know how to be aggressive to the system and advocate for yourself, and where they must end up every single time. I was in a car accident in July, and in the middle of shaking, because I genuinely thought another person was dead in this accident. Panic attack, my hands are broken. I am freaking out. The first thing I thought about was I have to deny the ambulance because I can't afford the ambulance. That was not I wasn't thinking about anything else except I have to call my mom so she can take me to the hospital because I'm not going to get in this ambulance. And I watched this poor paramedic be like, she's denying an ambulance. I'm like, I'm denying an ambulance. Put that on the record. I don't want this bill. That's what went through my head. And it's terrifying. And so, Erin, you asked this question of what can we do? There are other people on this panel that are going to talk about things like policies, that are going to talk about the steps that are going to get us there. One thing I know, though, is that I think one of the ways every single person that's listening right now can be a meaningful part of the solution is that we have to create permission for people all across this country to believe that they are owed better, to let them fantasize and actually dream of a better world. And instead of telling them that they are not being practical or pragmatic, that they are delusional and that this is naive, telling them that that's right and that the best policies and the best movements are not because of people who are asking for crumbs, but it's for people who are asking for us to shoot for the moon. And that's what we need to do. And it's okay as Americans, if you've ever experienced poverty or being broke, if you've ever experienced hardship, to know that it's actually not your fault. And if you ever felt that it was your fault, it's because the system is designed to tell you that. You are not at fault. You are allowed to believe in more and ask for more. You are allowed to demand more of your healthcare system, of your political leaders, and of your government. And how do we get people to believe that? We have to share the real stories, especially for those of us that experience the healthcare system in sort of its most middle privileged section, where it's not perfect, but we get by. How do we get all of those folks to be a part of this conversation and say, just because it's working for me doesn't mean we should keep it, because it's not working for everyone. I need to hear those real stories. I need to see those people represented in our movements, in our politics, in our entertainment even, so that folks can be a part of pushing the needle forward. And so I really, if I say stress this 100 billion times, I will say this as someone who is not an American and who has family all over the world and loved ones all over the world. I promise you, you are allowed to ask for more, and better is possible.
I am muted. I am inspired by that and have felt it. I've experienced it. And you're right. Not only do we deserve more, but we must demand it because it's possible. Thank you very much. All right, Bryce.
I think first I'm going to start by kind of just echoing what Abir said and how better is possible. Better is possible in terms of our healthcare system, our economic system, and our handling of this pandemic. Vietnam 3 days ago had its first community transmission in 89 days. They had not had a single in-country transmission in 89 days. That's crazy. And that was because of a flight attendant's brother, because she was quarantining with her brother. Better is possible, and we need to be demanding better of our government. I truly believe that one of the biggest failings, or one of the reasons we've been failing as a country, is we're not taking it serious enough. And we're not taking it serious enough because our political leaders aren't taking it serious enough. Coronavirus continues to infect people after 10. Why are we closing restaurants at 10? We should have restaurants closed all the time, because you can get a virus after 10. It doesn't go to bed. we need to stop putting the economic welfare of the few ahead of the health of the many. And I think that, I want to echo a little bit about Abila talking about how young people are affected. This is a little known fact that the vast majority of college students did not get the stimulus check that came out earlier in the spring. Because if your parents claim you as a dependent, you don't get the stimulus check. But most of us are still on the hook for our student loans and are still paying for our rent. And, for someone like me, as a person with a disability who's also a student, I don't work right now because if I have more than $2,000 in savings, I don't get health insurance because I get health insurance through the government and I'm forced to not work. I'm that, we're told to be self-reliant, to pull ourselves up from our bootstraps, but this system is made so we can't. And to force us to stay in a subservience to I'm sorry, to the people who control these strings of power, who are the same, the poll ad. I'm sorry, I'm losing my train of thought. I'm tired. The gist though is young people got screwed over by this especially, and there is no single solution. We must attack this as a system, as a community, and we can't do it individually, as individual states, as individual people, as individual hospitals, as anything individual. This has to be collective action.
Thanks, Bryce. Alida.
Oh, all I can say is, wow, you can see why young people are going to drive the change we need. What can I say? Going back to rural, our for-profit healthcare system is literally killing our rural healthcare institutions. The healthcare system keeps consolidating into larger and larger conglomerates that cherry pick private pay patients because in fact they reimburse higher than our people who are on our public insurance programs, Medicare, Medicaid, and Minnesota Care. And so these big conglomerates are just locating in places where there are wealthier, healthier and younger people so they can actually make more money. So this is a big driver of healthcare inequalities and how it affects rural people. Our rural hospitals, because of what I've already said, are disproportionately serving people who are on our public insurance programs. And because they are not money spinners, not profit centers, these big conglomerates are actually, quote, cutting their losses by divesting of these rural healthcare institutions. But when we think about what's going on in this pandemic, so many people are losing their employer-based insurance with their jobs. More and more people are enrolling in our public insurance programs. It's just, and then if you're not in one of those, you cannot afford to buy insurance on the individual market. It's just too expensive. So it's clear the market cannot solve this problem, and it's really it's we, the people, who need to solve this problem. As our two youngest have already said, people have to drive the change that we need. So I really think, from what I've seen, the only way we can have healthcare equity is if everybody has equal value in the eyes of the healthcare system, and it's not possible in this current system of private and public insurance. People should be reimbursed, or providers should be reimbursed regardless of who they treat. Patients should no longer be cherry-picked as profit centers. So I believe the best solution for us is really to create a publicly run insurance system that Erin has already talked about, where Minnesota could reimburse providers directly for the care that's being provided. And in that system, I think we have to recognize people can actually choose their doctor, and the doctors can actually choose the care that they want their patients to have. Insurance companies should not have anything to do with those decisions. But I have to say, just looking at what's happening with rural healthcare, leveling the playing field in terms of reimbursement doesn't go far enough. Rural hospitals have relied on elective procedures and surgeries because there is higher reimbursement to try to keep themselves afloat. And of course, these aren't happening right now. So they are barely hanging by a thread. Rural hospitals are going to close in this situation. And also just hearing Commissioner Malcolm the other day saying that we are losing so many of our rural healthcare providers right now through layoffs, and people are just deciding that in this moment they're going to retire early, and particularly acute shortages are found in primary care and mental health. I would just like to say, people have talked about what do we do about rural healthcare? Well, clearly we can't have a system that's based on volume of procedures as a way that you maintain critical access for everybody, regardless of geography. Our critical access institutions need a guaranteed source of income. So people have talked about global budgeting, where you say, we're gonna, and clearly this happens in other countries. You care for a population of patients, and it's not based on volume of things you do to people that you get paid. You create wellness for populations. So, people always ask me, well, how can we possibly afford this? Well, I keep telling people, in 6 months this year, United Health, the largest corporation in Minnesota, cleared $10 billion in profits. So what we really need to do, as Abir said, is shoot for the moon and realize that we all deserve, and what we need to do is just demand that there be a shift from profits to the care that we need. This is what we need to do. We just need that political will.
Have you got the political will, Alita? Mary Turner, what's your prescription?
My prescription. So you have to understand that I'm coming from the perspective of the front line. So I see things of what I need right now, what all the nurses, what all the frontline healthcare workers, the doctors, respiratory, all of us need right now. And our National Nurses United, which is our affiliate, has been pushing for the Defense Production Act. I was in after my tete-a-tete with the President-elect Joe Biden, I got an email from Australia. And it was really poignant because it was very condoling type of tenor to it. They were like, God, we feel so sorry for you. Here in Australia, we have a new norm. We all wear masks, we all social distance, and guess what? It's business as usual. Everybody's open and everybody's functioning. And I thought, well, now wouldn't that be wonderful if we could do that same thing? However, we cannot do that because we don't have enough of it to be able to go around. And when I say to go around, I don't mean just Dr. Hannah there, who's still wearing her N95 5 times, or my rural nurses who are still wearing them 10 times, or even myself that's wearing them 2 times. I'm talking about the bus drivers and all the workers out in the field, everybody. I'm talking about everybody. We don't have enough produced. We could during wartime, we can do that. We can make guns and tanks and planes and all that stuff. Well, I'm sorry, we're at war right now and people are dying. I would imagine by the time this is over, more people will have died from this in the recent history than any war that we've had. And yet we don't see it, that we need this necessary ammunition. And this is my big mantra. This whole thing is just to be able to have the protection. And what people don't get is I very much resent the fact the way a public health crisis has been politicized because of the way that people's attitudes have been changed because of certain very irresponsible leaders that, I'm sorry, I personally will never forgive for that. And it's inexcusable, and never worth forgiving for what they have done to our society by their examples. Because just a little bit of different train of thought could have made a whole difference. Could have made a whole difference. And now everyone sees it as they have the freedom. How are we going to fight against that? They have the freedom to throw the frontline healthcare workers under the bus. We're the ones taking the brunt of this. We're the ones that are dying, and along with everyone else now, but it's kind of like, I don't know, and there's other things that we want, on a more basic level that we've gone to our state for. We'd like no visitors in the hospitals. We get it though. I mean, it's like their argument is patients need to have their loved ones there too. But it feels way more safer in a hospital when you've just got the people working there and everyone's wearing masks and everyone is doing their job. It's kind of, we got the response, it's going to be left up to the hospitals. We want rapid testing for healthcare workers. They talk about a shortage of healthcare workers, and yet we've got healthcare workers that are waiting 5-6 days for results, when we know that we've got rapid testing that can be done in 2 hours. Okay. Now they're talking about shortening up the quarantine time because of the staffing shortage. That's what I heard today in our governor's task force, is that they want to try to shorten it up. I don't think MDH is all for that idea, but it just goes to show you they want us coming back. If we're not asymptomatic and we're supposed to get back on the job. And that's a recipe for disaster. So I'm not all the grandiose plans. I got to think about what we need right here and now to try to get us so we can stay and serve the people like we want to do. Is that so much to ask?
No, it's not. And we have to be very practical and very focused right now, Mary Turner, because we're in the middle of a crisis, and you're in the middle of a crisis, and that you have to ask for rapid testing, for plans for elective procedures, for enough personal protective equipment, for time off if you are sick or you've been exposed. All of that is symptomatic of a system that is more interested in protecting its bottom line than it is protecting its people, patients, and the care providers.
What they don't realize is we are the ones who make their profit.
Right.
It's like having a factory without the machines. You're not going to, you know what I mean? They're being very short-sighted.
That's right.
Oh.
Thank you. And Hannah, Dr. Hannah?
Well, yes, set me up beautifully there, Nurse Turner. So I quit my job during this pandemic because of what was going on where I used to work. I want to finish by telling you all why. And like many Americans and Minnesotans, I was paid on commission. I worked for a big company. I earned a teeny tiny fraction of what my employers did. I was pushed in each interaction I had to do more, to maximize profit. And I was pushed to sell more and do more every day. And that was as a primary care doctor. As a doctor, I cared for patients in my own community, but the commodity that I sold was health. And that's not what I signed up for. And that's why in the middle of a pandemic, I quit. Now I did find a job in a different institution with different values and structure, but that was honestly hard to do. But I quit my job because I couldn't any longer uphold my oath to first do no harm. The conflict I felt between my ethical and professional responsibility to provide care to my patients and the healthcare system's priority to turn a profit, it led to a moral injury. And that's an injury that I'm not alone in experiencing as a healthcare provider in our system. This leads to not only that moral injury for physicians, and I'm sure for nurses, but also to poor health for our patients. And it's been worsened by COVID-19 because our failure in Minnesota, as in the rest of this country, to provide quality care and protect the health of all people during this pandemic stems from that conflict between the effort of some to care and of others to earn. So when viewed through an economic lens, that accelerating wave of hospital closures and clinic closures throughout our state, it makes sense because it's not profitable in our current healthcare system to take care of the sick or to care for folks in rural communities or in our urban centers. And those are the clinics that are closing, but those are also the communities who need help the most right now. And there again is that conflict, because those who have been denied care and resources are denied those resources specifically because they need them the most. And so as a result, the health of Minnesotans suffers even more. So I quit my job and I got a new one. And with Our Stories, Our Health, I have been fighting and advocating and pushing for a change in this platform, a change in how we envision health and healthcare in Minnesota, because like Abir said, we deserve better. And so, Erin, to answer your question, how do we get there? We fight. You know, this system, not only does it fails all of us, it fails everybody who is trying to live a healthy life, but it also fails those of us who are trying to provide care and healing, because we can't in this environment. And so we all have to come together. This isn't a time for any of us to silo. It is a time for us to build alliances and to get strength from working together. And so I think that's how we move forward. We do have to completely re-envision what we want this to look like, and we have a chance to do it. There is, with all of the destruction and the grief and horror from this pandemic, it does give us an opportunity to build something better in its place as the system we see and that we're a part of, it fails. So I have great hope for what we can build together.
Thank you. Thank you, all of you, for filling me up with possibility and purpose. And by sharing your stories tonight and with the people who are with us, I hope inspiring action. I'm going to turn this over to Haley Bloom Peterson, and she's going to talk a little bit about declaration and make an ask, and then she's going to manage the questions. We've gotten a lot of questions from people in the chat, so she's going to manage the questions for you, and we'll be together for another half hour or so if you can stay with us. If you have questions for our expert panel, we're going to get to them. Haley, take it from here.
Hi, thank you, Erin. Hi, everyone. I am just really feeling a lot of energy right now, which is great. I'm going to just share my screen really quickly to show you something that we've been working on in the last 8 months or so, and that is our declaration of health. It's essentially a mission statement, I would say, but I think it feels a little, it hits on a little bit more of the values that you've heard these panelists talk about. So our declaration is a public system of healthcare for all, publicly funded, publicly governed, and accountable to the people. It is separated from the privilege of employment and wealth. It is equitable in access and outcome for every person who lives anywhere in Minnesota. Anything less than this is inadequate, discriminatory, and unjust. The stories and experiences of Minnesotans are the proof of the need for transformational change. This organization is committed to this wholesale change, and we are constituted to create it. So that is the work we have before us, and we cannot do it alone. We are so grateful that you gave us the contribution of your time tonight, but we are hoping that you will also consider a financial contribution to Our Stories, Our Health. Your gift to this organization, we are small but mighty, but your gift will help us to build our base of Minnesotans that are demanding a better healthcare model, and to grow our coalition of nonprofit organizations and activists and advocates so that we can really, really get this work done. And you can make a gift online at ourstoriesourhealth.org/contribute, or just, Google Our Stories, Our Health, and you'll find it right away. We're all very tech savvy now. And we just so appreciate you being here tonight and taking some time out of your day. And I will just be going through the people who have asked questions from the beginning, and I'll call on you and let you know that you're up, and then you'll be able to ask your question of the panelists. So Dana Kolatar, you are the first one. I'm going to add you into this chat now, or in the room, I guess. Don't know. Okay, there we go. And you'll just have to unmute yourself, I think. Okay, maybe this is the wrong Dana. There are two. Okay, I think we got one. Dana, are you still with us?
Oh, here we go.
Yeah.
Hi. So my question was, Alita spoke very eloquently about the troubles that many rural people suffer with healthcare access. And I'm wondering if you might have a response to why these people continue to vote Republican when Republicans are not helping them with those types of problems.
Well, I think I'm not the only one who can speak to this, but I think, one of the struggles that we have to wage is against this whole question of what people fear about socialized medicine. And that's why I specifically brought up the whole question of choice, because in fact, people feel that somehow, government-run healthcare means that we won't have any choice or control of the kind of health that we receive. But like a beer, I've also experienced healthcare in another system, which was incredibly wonderful in the UK. But, I think the whole question of choice right now, I think people have to understand that, especially in rural places, you don't have choice about, who you can see as a physician. Physicians cannot prescribe what they want to prescribe for patients without jumping through incredible hoops to get pre-existing authorizations for, for the procedures or medications. And so I think once people begin to understand, just what might be possible, with everybody in a Minnesota Care program. There's hardly anybody, I've never talked to anybody who doesn't absolutely love Minnesota Care, because they have comprehensive care coverage. They have almost no out-of-pockets. I think people are just fearful as well. The whole question of taxes, how is this going to be paid for? Well, like I said, when I tell people that we have an insurance company that in the midst of the pandemic, because they're denying people care and not providing care, cleared $10 billion worth of profits in our state. That's plenty of money just to cover the healthcare needs of people. I think, people have to believe, but I think, It's a bigger issue of why people vote Republican, but it has a lot to do as well with racism and the feeling that somebody's getting something. If I'm barely struggling to stay afloat, and if somebody gets something, it means it's coming from me. Instead of us joining together and realize there's abundance in our system, it just needs adequate, fair redistribution.
I would jump in just briefly to add that, Alita, you just hit the nail on that head with that last point, because the question was, why do folks in these areas vote against their interests? Well, not everyone in those areas does, but those who are allowed to see fellow workers, fellow people who are left out to be discarded by the system as the enemy, rather than the folks continuously at the top who are benefiting over and over from our collective harm as the enemy. They're going to vote because I believe that many people hope that they can be brought into power with them, that they believe the Republicans are telling me, and these other folks are telling me, that the reason that I am having such a difficult experience with the healthcare system is, one, it's either my fault and I'm the problem and I need to fix it, or two, it's those Black and brown people over there. They are the problem. And if I keep voting in this direction, I'm going to be pulled into power too. Maybe I will be saved from this system.
Thank you.
Sorry.
Go ahead, Bryce.
I think one thing to add is no matter where you are in this country, the people who aren't voting are more than the people who are voting. And my main political philosophy is we need to bring those people in. We need to show them there is a better world and you can vote for it. And we need to make a party into that and have a future to strive for and to believe in.
Right on.
All right, Jean Foreman, you are up next. Let me pull you in here.
Hi, I'm so glad I am part of this. It's really great to hear such a powerful talk. But my question, and thank you for taking it to the panel, is how does the panel see the labor movement advancing the cause of healthcare access, demanding worker protections, and changing the balance of power to benefit our communities?
Hey, Jean, I'm glad that you're with us tonight. I think two things. We are seeing a resurgence of organizing in Minnesota, and I hope across the country. Low-wage workers, people who work in jobs that bear a fair amount of risk, are organizing because they know, that without collective power, we're not going to successfully take on the corporate interests that are demanding our labor without a fair payment, and they're often putting people in harm's way. So I am, for the first time in my life as an adult, seeing real organizing happening and a real interest in organizing across the professions. I hope that infuses more power and collective action in the labor movement itself. In my early work at M&A, before we joined the AFL-CIO, I observed a labor movement that was contracting and a labor movement that was pretty focused on a narrow band of self-interest. And that has changed significantly. As I think labor has contracted, it has grown more creative and it is growing its base of power. I think that plus young people and workers and people who have been experiencing income inequality are the recipe for a labor movement that is rooted in collective action and is rooted in actually delivering what collective action can for the people, including in healthcare. I would love to know if others have a perspective on that, but I think we're moving in the right direction.
Yeah, Jean, I know you hear me talk all the time, but I just want to point out something that just recently we organized 300 nurses in Bismarck, North Dakota. This is a state that has not seen a new organizing drive in over 40 years and has been a right to work state since World War II. And the reason those nurses organized was that so they could have a say in the care of their patients, so they could have a voice at the table. And this is worth noting because this is exactly why the young people of today that are finally getting, because they certainly don't get education about unions in school. You know, that was taken out a long time ago. Civics is, you know, I had civics class, but I'm an old lady. They don't get that anymore. But people are they're workers all over, the collective power of a union and having a voice in your workplace and having a voice at the table, whether it be at your work or politically, et cetera. They are finding out that the only way to do that is to unite together in a union, because the conditions right now are no different than they were when the union started back in the 1930s. The old on the waterfront Marlon Brando. We just don't have as glamorous new movie stars, but it's no different, guys. It's no different. The conditions are probably even worse. And so it's prime. It's prime. And I know that nurses and Hannah, I wish doctors would get on board too. No, seriously, because more doctors aren't they employees of healthcare companies rather than their own clinics?
Yeah, no,
More and more.
Yep.
Yeah.
No, and I think, you know, to answer the first question, I think that, you know, the organized labor movement is the model, right? Like nobody, I think it is the inspiration, it is the model. That's how we get there. I think it is a clear path to getting there. And and absolutely, Mary, you're so right. And that's part of what makes it, you know, we are employees as physicians almost all the time. And that's new. That didn't used to be how it was. But,
Right.
you know, I can't, as an employee of a larger organization, unless groups of healthcare providers are organized, there's no pushing back. There's no saying, hey, Fairview, don't close St. Joe's, and Bethesda, we think that's a bad idea, because there's no unified voice. And I think that bringing, you know, doctors, nurses, all the healthcare professionals together to say, listen, you know, we are the ones doing this work. We are the ones caring for patients, and we together, unified, organized, you know, need to be able to, you know, do that regardless of cost. You know, we need to, if okay, so it's not profitable to keep these hospitals open and care for the sick, redesign the system, make it work. You know, fix it. If that's the issue, make it so that our hospitals can stay solvent when caring for Minnesotans. Don't just give up on caring for the people whose insurance doesn't turn you a profit. And so, yes, I think that organizing is necessary and important and a way to build strength and power. And we have a lot of work to do.
Sorry, go ahead.
Well, I was just going to say that I have been in situations where I've seen where there have been doctors who have been organized. When I was, this was some time ago, but when I lived in New York, doctors, there was a union for doctors. And I know that there's been some organizing, you know, within researchers at Mayo. And I think part of it, I see, you know, Mark Brocky has made a comment in the chat about doctors being difficult to organize. And that's because, in fact, there's such stratification of of doctors in the same way that there's class stratification in our society and done by race. Well, and it's done by specialty in medicine. But I was encouraged by the fact that last year, I think when the American Medical Association had a vote on supporting and endorsing Medicare for all, it almost passed, and it was a lot because of the younger residents who were there as part of the meeting. I think it lost like 53 to 47. So I think that as more and more doctors are actually finding themselves, employees making widgets, as I might have described it when I was in the clinic, so many RVUs per patient care per consultant and work day. You know what I mean? You've been there, Hannah. You're making widgets. You're not actually delivering care. More and more doctors are in that situation, and more doctors are going to fight and need to fight to be able to restore the honor of the profession, frankly.
I agree with what everyone said. I'll first say I honestly think that if every union in this country, or 75% of the unions in this country, were as good as MNA, we'd have single payer healthcare like that. I'm saying that completely seriously. I think that there is no better movement to take this up, and both in terms of unionizing doctors, unionizing custodians at hospitals, unionizing X-ray techs, unionizing cafeteria workers at hospitals. It also means unionizing frontline grocery store workers. For example, my girlfriend is a Target worker at the Midway Target, and about 2 weeks ago, we had a little bit of a COVID scare in our house. So we both decided to get tested, but she was supposed to work that day. So she called her manager and she said, "Hey, I'm coughing. I think I might have COVID. I'm going to get a test." And her manager said, "Well, we'd like you to come in, but it's up to you." Luckily, she didn't have COVID. She decided not to go. But if she had had COVID, which was very possible, she would have just infected all of her coworkers. And when her manager told her that, she had no one to go to. She didn't have a union representative to go to.
Right.
So she didn't have recourse. She was stuck. And every worker should have someone to go to and ask for help. And that's what the union can be. I mean, I know that I'm stealing Mary's bit a little bit here.
Oh, preach.
Start talking. If you look at anywhere, you can form a union.
That's right. Thank you for that compliment to M&A. And I have to mention Rose Roach, because I know she's sitting on this call, and more there's the lady that if you want to know anything about Medicare for All, you just go to Rose Roach, my executive director. I hope you heard that, Rose.
All right, we have Emily Benzie next, and then Ann Jones, you are on deck. So let me just switch out.
Oops. Hi, thanks for taking my question. Thanks for this amazing discussion. So important. My question was kind of very specific and back to something that Mary had mentioned about the healthcare workers not being able to get rapid testing. That to me seems like something that should have been available so long ago and would have helped, prevent a lot of the spread that's happened. Do any of you guys have any idea as to why that hasn't become more widely available? And is there any hope of that changing anytime soon? I don't know if any of you know, but I just think about, I don't know how many times a week the professional athletes are getting tested, but it just seems like an incredible inequity that the healthcare workers can still be waiting close to a week to get their test results back. Thank you for taking my question.
And they'll say that at first it was they didn't have enough tests, and there you go back to the Defense Production Act. You need more people to be able to test the amount of testing that we need to do. And I know that our hospital, when they first come out with a rapid test, and they were only to be used on like traumas and people coming in for psychiatric care, we got 600 tests. And then all through that whole first season at a level 1 trauma, they just were very cautious how they use those, because we got 600, and we could have easily used, I mean, every night at midnight, there's 50 people in the ICU or in the emergency department. Do you know what I'm saying? So there wasn't enough to begin with. Okay. And then it's the idea of, do they really want us tested? Sometimes you wonder, do they really want the healthcare workers tested? Because now they're trying to, if you don't have any symptoms, they really would prefer that you come back to work, because we're in a staffing crisis. Did you know that we're in a staffing crisis right now? Thousands of healthcare workers in just Minnesota alone are out with COVID related issues. So I don't know if that's true or not, that they don't want us tested, but it sure feels that way sometimes.
So I can speak directly. Oh, sorry, Alita, I jumped in, but I was previously worked both at a nursing home and in a clinic, and there were some rules that came out from Medicare that everyone working in a nursing home had to be tested regularly for COVID, just to protect the people who live there. So I was never tested in my clinic, even though I was in a COVID clinic specifically caring for patients with COVID. But because I was at a nursing home, I had to be tested. But that then led to a huge fight between the administration of the organization that owned the nursing home where I worked, and my employer, which is one of the large healthcare conglomerates, or was at the time one of the large healthcare conglomerates, because I was contracted out. Neither of them wanted to pay for the tests. And that's what it came down to. It was a fight. Neither one wanted to let me get that test without me paying for it. And so it took weeks to figure it out, who was going to pay for me to get tested. So in the end, they pay for the athletes to get tested at the university because the athletics program brings in tons of money. They pay for the professional athletes to get tested. They can afford to, because by testing and playing, they make more money than they do by not testing and not playing. The day-to-day work of nurses on the wards or in the emergency room doesn't make them enough money for the hospital to want to do it. And that's where it comes down to, is until they were forced to provide testing, they didn't.
I worked on the front line since February, and I have yet to be tested at work as a COVID ICU nurse. I had my first test last Thursday only because I was having eye surgery.
I would just like to speak to the specific question that Emily raised about rapid tests. And I remember hearing I'm just struggling to remember his name. He's a nationally prominent cardiologist. I think he's at Scripps now. And he was talking about the development of the tests and the fact that the importance in terms of rapid testing is not just most of the tests were based on the material showing that you had clearly had been infected, but not actually infected at the moment. And that for a long time, there was the ability to produce those tests, but that it was not a priority of the Trump administration to actually push for the development and mass production of the tests that would allow you to know whether you're actually infectious. So this was more a decision that was made by the Trump administration, actually.
All right, thank you. And I think this will probably be our last question. I'm going to throw it to Ann Jones. Just give me 1 second.
Oh, that's a lot of pressure, Haley. Thank you. And thank you, Erin and Haley, for leading this. And Alita, I hope you run again. I'm one of your biggest fans. And and Mary, you certainly made an impression on the president-elect. I saw the roundtable Oh my goodness. Um, and on that subject, I'm thinking it's time to change the narrative. We are lacking a sense of community. We are responsible for stopping the spread. Our healthcare workers are the last line of defense. And that's not original to me. Somebody actually expressed that before me. But my question, I think, is about does anybody care to kind of comment on what you think our next steps are to fixing how we pay for healthcare so that we have a more rational healthcare payment system without, this powerhouse of panelists here? What do you think are good next steps? Building political power, a timeline, people power. What do we need to be doing? Priorities.
You need people
organizing
power.
People power for organizing for change. Yeah.
I mean, I think you kind of have where we need to start, which is we need to build the community, and we need to. I think one of the biggest failures of the United States as a country is over the last 150, 200 years we've interpreted freedom to mean freedom from each other, but actually it should be freedom to be happy and be successful and care for each other. And you're right, we need community to do that. So I'll let people jump off from there, but the starting point is to build community. You're right.
I think now that it's gotten all over the whole state, I think back the first wave, when it didn't affect all of northern Minnesota and it didn't affect a lot of southern Minnesota, it was a lot hard. It was a lot easier for the other forces to infiltrate, if you want to think of it in war terms, to infiltrate with their dogma of disbelief, etc. Now I'm hearing stories of, because we represent nurses in both Iowa, Wisconsin, North Dakota, and Minnesota, of course. And I was hearing recently from nurses in Wisconsin that a lot of in these rural hospitals, and doctor, you would appreciate this, are getting upset with with the hospital nurses because what do you mean you don't have a bed for my mother who's having a heart attack? Or what do you mean my father who's having a stroke, you don't have a bed for? This is our town hospital. You should have a bed. Well, of course there's no beds because most of these critical access hospitals are 25 beds total, people. That includes their emergency room beds. And so they're not designed. They're not designed to take care of a pandemic. They're designed to take care of the needs of the town that maybe has 100 people or 1,000 people, whatever, but they're not designed to take care of a pandemic. And I'm sorry, but I've always held with the rationale that people have to suffer enough to pay attention. I'm sorry, that's just the way that's a pessimistic view, but until you've suffered enough, people are not going to pay attention. And I think the suffering is starting, if it hasn't already. But it's got to be, that's what my mother always said. Once you suffer enough, you'll start to pay attention to me.
Well, Mary, I think you're right. I think I think the movement for change is going to come in some ways from rural, because this is one place where I think we can build some unity around the changes that need to happen, because there's no way that we can save rural healthcare in the current financial model. And yet people still live there, and it's older people who are the most vulnerable who are living there,
Right.
And so then, the rural leadership there and rural electeds are going to have to come to terms with how are we going to make sure that everybody, regardless of where they live, has access to what they need. So this is the organizing that has to happen. And
definitely.
And then
Unfortunately, with the kind of
go ahead.
Death rates and sickness and death rates, we cannot afford to wait for everybody to have their own personal epiphany about this particular crisis. The long-term crisis is, the cost of healthcare big picture, but right now, the level of disinformation is really pretty shocking. But I mean, I'm trying to look ahead a little bit. Should we get past this, you know, in the next 6 months to a year, what kinds of, you know, power should we be building?
I I think that you know, thinking about what's next is really important. One thing that really terrifies me is I think that even once the crisis is over, it's not going to be over. I think that the
Right.
healthcare professionals here can speak to this a lot better, but we're already seeing huge long-term impacts from COVID. And there's gonna be a lot of people of my age group who viewed themselves as invincible, got COVID, and now have
Have
lung
long-term
conditions,
effects.
have heart
Absolutely.
conditions, have
Mhm.
psychological effects.
That's right.
And there's gonna be a healthcare system that is not built for that.
That's
And
absolutely right.
there was just a report that came out today that scientists are worried that if a ton of people get the first dose of the vaccine but don't get the second, the vaccines or the disease or the virus will become vaccine resistant. This needs to be the largest mobilization of government resources in human history. And everyone needs to be vaccinated immediately and for free. And we need to have a full idea of the health condition of every citizen of this country to rebuild a system that can take care of what will be an increasingly ailing population.
Yeah, and Anne, I would just point out, you say, what can we do right now? I think I had some nurses right after the election that were, I think they were, Republican leaning. And they said, well, what difference is it going to make? What difference is President-elect Joe Biden going to make? And I said, the fact that he believes in science, that's an improvement right there. The fact that he believes that this is real is an improvement. And so in that respect, because I'm sorry, we have to have an immediate response, the right response from our federal government. And that is something immediate that has to happen.
And I think on that note, we so just catastrophically failed the arrival of this pandemic and the opportunity to collectively shed a light on what this illustrates about the system that we live in and how unfortunate it is. The reality is, as Bryce pointed out, we will have one more opportunity, which is the opportunity to move our society past this disease, the largest mobilization in history, an opportunity to show what collective, centralized, federal and state level responses look like, ones that again are centered on the needs of our most vulnerable and most harmed, that put those people first, that put workers first, that put the needy first, that put the vulnerable first. We can actually show people, the folks that create the resistance, not because they're at the very top, not because they're the special interest, but when everyone in the middle that says, I don't see why we need to upend the earth for our healthcare system. I don't see why we need to get to the foundation. We might be able to change their minds if we show them one time just how possible it is to have care for our society that works for everyone, the best care that works for everyone. I don't know every single solution for how we will accomplish that, but I will tell you all as folks who are Minnesotans, one of the places we're gonna have to do that is we really need our state leaders to get on board and be prepared to do this, not just for their interests, not just for their reelection, not just for the immediate tomorrow, but because it is in the interest of the state forever and this conversation on healthcare forever. My generation will be foundational. Their understanding of healthcare will be foundational to this moment. And if we miserably fail them and show them that this is not worth investing in, then I don't know how much they're going to buy into it.
I think you're right, Abir, that we have this opportunity. I also think we should take credit. We should try to be effective, work really hard to be effective, but also take credit for it and say, this is what good government looks like. Because we really often fail we just, being quietly competent is not going to actually help us in the long run. because it's too easy to tear down government. And we've seen that been going on in the last 35 years. I kind of say government needs some good PR, you know, and good government needs some really good public relations. And it isn't going to hurt to take credit if, you know, let's do it right and let's take credit for getting it right.
All right. All right, Ann Jones. For anybody who's with us, Ann Jones was my preceptor when I was a new OR nurse at the University of Minnesota. We have known each other for a long
time.
That is right. That is right. We were in the middle of another epidemic.
Yeah.
In the midst of the AIDS epidemic. That is right.
Yes. Only this one is far more dangerous. It's respiratory. I think people, I try to explain to people that the AIDS epidemic was scary for about 15 years, but it was nowhere near as scary as this respiratory pandemic is. So give people today, Mary and everybody on the front lines, credit for coping with a really scary, dangerous new challenge. I'm hoping that we can help out, you know, those of us who are in the retired corps, help out with, you know, maybe immunizations, vaccination program. I plan to volunteer.
Good.
You know, should that be an opportunity?
So I'm going to turn it to Abir because we are past our 8 o'clock hour. Abir, I'm putting you on the spot. But you said something that I think is really profound, which is what we deserve. And I'd love it if you close us out by reminding us what we deserve and what we should fight for.
Well, thanks, Erin. I'm glad that struck a nerve because that was my hope. I am not saying that anywhere in the world have we achieved a perfect model for healthcare. I know that there are disparities everywhere. That is the world that we live in, and the fight for everyone continues. But with that said, the system that we have right now has handed people less than crumbs and told them not only is that enough, but be thankful. And the fact that you do not have more is your fault, and asking for more, well, that is just not appropriate. Having a healthcare system that sees every single child in our community as our child is critical, that sees the most vulnerable among us as our measure of our safety and our health is important. I believe that we are owed a healthcare system that is equitable for all people, that is not contingent on wealth, that is not contingent on employment, that is not contingent on your race, that the moment that you are born, your fate, the fate of your health and of your family's health is not sealed based on your zip code. That is all fair, appropriate, and right to ask. And if we are willing to demand it, I believe that we can get there. Abolitionists have really set up a model right now for what it means to dream big and incrementally move in that direction, reminding us that when, again, we ask for nothing, we will be given less than nothing. And so I really think in this moment, it is okay and it is right to fantasize about a healthcare system that's going to treat all equally, that treats every single child born in this nation equally, so that we can all live happy, healthy lives. That is the model. And I hope that all of us are willing to dream about that and fight for that and center ourselves in that, because we are only as safe as the most vulnerable in our society.
Thank you. Thank you, everybody, for being with us tonight. Thank you, expert, beautiful panelists. Thank you for your fight. Thank you for joining us.